You're watching Agenda, and it's a day after 20 people were killed in Bhubaneswar of Odisha in a fire at the premium SUM hospital. And just a day later, we're getting to know very disturbing details. We're getting to know how just in 2013 an audit was done and yet no heed was paid. And we're also getting very disturbing details of how in Odisha, out of 1,700 hospitals that are there, only 4 have their fire safety audits in place. And so we have with us the Union Minister of State for Health, Anupriya Patel. We also have Ashok Agarwal, a leading lawyer who's been fighting for health safety and people's right to better health. We also have with us someone who has just retired as the fire chief, A.K. Sharma. And we have with us Parumita Guha Thakurta, who is a member of the AMRI Fire Victims Families Association. She lost someone in that major fire at the AMRI hospital in Kolkata just 4 years ago. And she's going to talk about what it feels like to see that happening over and over again. But before that, some more details have emerged from Bhubaneswar, details that the health minister there may have had some connection. It's being reported there right now that the reason why that hospital, the SUM hospital, was still operating even though it didn't have all its NOCs in place is because of its connection with the government, with the health minister. My colleague asked him about that, and his name is Atani Sabyasachi, the health minister. He asked him about that, and here's what he said.
This was not discussed, but I told him that if the government wants that the people should have the confidence in the administration, then tough action on such issues which are being raised is to be taken.
This was, of course, Health Minister J.P. Nadda. We'll play out the other instance as well. But first, if I can just go across to Anupriya Patel, the Junior Health Minister of the Union Government. Ms. Patel, these details that are emerging from this immense tragedy in Bhubaneswar are truly disturbing. What is your government doing about this?
Look, as you said, that the hospital in Odisha, the SUM hospital where the actual incident took place, there was no clearance for fire safety. So this is one problem which we have noticed across the nation. Clinical establishments have been operating without any standards and norms, and somehow the state governments have been lax about this entire thing. So the Clinical Establishment Act was passed in 2010, and NDA government is making all efforts so that this model act which was passed in 2010, it is adopted by all the state governments so that all the clinical establishments which are operating within the territory of a particular state, they follow the norms and guidelines, and a proper regulation and monitoring of such clinical establishments is done, and such kind of shocking and serious incidents do not take place. However, not many states have adopted this act, but we are still encouraging them, and we have also given them the liberty to modify or make certain amendments if they require. But what we believe is that this is a model act, and once all the state governments adopt it, such kind of incidences, like the one which has happened in Odisha, will not take place in future. We'll be able to, have more faith of people in the healthcare system.
Ms. Patel, the thing is that for a lot of people, this seems very, very disturbing, because if you look at the instances and the circumstances of what happened at AMRI in 2011, it seems quite eerie, because even there were instances like the smoke detectors, fire alarms weren't working, that they were also charged, that there was an audit done and nothing was actually put into place. And every time we hear people say that, we are going to put the mechanism into place, that next time this doesn't happen. I know that for the union government says, and we heard the health minister also say today, that this is a state matter, but can you intervene, because it is a matter of life and death? And the fact that only 4 out of 1,700 hospitals right now in Odisha have the requisite clearances, can you do something about that, intervene in that?
Look, I absolutely agree with you that this is the issue of life and death, and you have seen that the Honorable Prime Minister Shri Narendra Modi ji, he had a personal concern and he immediately spoke to the Union Health Minister when he learnt about the incident, and our Union Minister is there in Odisha today. He's met all the injured people who were shifted to all the various hospitals when the incident took place, and he's also conducted a meeting with the state government. And we are, we are actually trying to give all the possible treatment in AIIMS Bhubaneswar and elsewhere to all the people who have been victims of this incident. We are very serious about it. But as you said, it is a state subject, so it was the first prime responsibility of the state governments to ensure that no such hospitals which do not follow the fire safety management guidelines are allowed to operate. Now, this was the first mistake which was made by the Odisha government, that this hospital was allowed to operate. And we want that such things should not happen. That is why we are encouraging the states and motivating the states and communicating with them again and again that please adopt the Model Act, because once that act is in place, once those guidelines are followed, we will not see such incidences occurring in the future. But we can only intervene within the limits of the Constitution, and we are trying to do our job. We are also going to issue, more advisories in future, because the state government ultimately has to take care of it, and the center is not shunning, away its responsibility. We are doing whatever best is possible for us. We are responsible, we are sensitive, we are deeply anguished with this incident. It is terribly serious. And we are also making sure that the state government must punish the culprits, because these kind of incidences cannot be allowed to happen.
Okay.
Madam Patel, I would like to ask one question from you. That is that you are well aware that health is a state subject, and in our entire country, no state has come up with the regulations, right to public health. And your policy of 2015, you have assured that as the amendment, as was done in the Right to Education Act, the state subject was brought to the concurrent list and then made a fundamental right, and then there was a national law. But till date, we are not seeing that anything is being done. And since the central government has not done anything, mandating the states to do certain things, no state is doing it. This is all going just like abdicating their responsibilities. And
yeah, go ahead.
Central government has not done anything. I just mentioned about the Central Establishments Act, which has been passed by the Parliament, keeping in view these kind of problems and keeping in view the concern that such incidences should not repeat. But we are also, encouraging the states. Not many states have adopted it, but we are still making our efforts. We have not left making any efforts. We are still encouraging states, yes, because we know that once it is in place, these types of things are not going to occur in the future. So you can't really say that the central government has not done anything.
I think in what you're saying and what Ashok Agarwal is saying, what you're all saying, the message that to lay people like us gets conveyed, that it seems to be stuck in a no man's land, where no one really seems to be. The state government, it's in the state list, but then will the advisories from the union government help? Paramita Guha Thakur, come in over here. For you, as someone mourning the loss of your family member, that horrible AMRI fire which killed 90 people, to see this happen again in Odisha, what does this mean to you, and does what the minister say now make sense to you? Paramita? Okay, we're just going to go back to Paramita as soon as we fix that line. Mr. Sharma, the really shocking thing is that the fire authorities keep giving these licenses, and yet hospitals who don't have them are able to operate. Can you tell us how it is that 1,700 hospitals are there in Odisha right now which are operating and they don't have the requisite permits?
In my mind, only one thing comes, they should not have been allowed. The buildings are not cleared from fire safety point of view. A building should simply be not allowed to run. More particularly, the building.
So who is responsible for that, sir?
You see, the administration, the local authorities are responsible.
You mean
for
the
it.
state government? Which department? Because I think we
The
need
building
to know.
department.
The building
Yeah,
department.
they are primarily
So
responsible.
it's the civic authorities.
They are primarily, building department is responsible for issuing occupancy certificates. Now that can only be issued to any building when it complies to the requirement laid down in the local building bylaws. In any state you go, they have local building bylaws, and the construction activities are controlled by them. The building cannot be occupied unless an occupancy certificate is issued, whether it is provisional or it is complete. There are practices where they issue provisional as well, but then finally one time they have to take a completion certificate for occupancy of the building. Now that cannot be given unless that meets certain requirements, and fire safety is one of them for the building which are specified in the building bylaw.
Right. You know,
Fire safety is governed by the municipal laws, and maybe there are various states where you don't have a law on this, and if you have a law, it is weak. And where it is a law, strong law, it is not implemented. The result is ultimately that
the advisories which the center is now giving the state.
No advisory.
What do you think that will happen?
No, the states are not concerned now. States are not concerned with the issue. You go on advising them unless you do it under the law,
Yeah.
mandating them that you have to do this. Otherwise, this will be deemed to be in implementation. Like
Okay.
this, there should be. It is not that the central government cannot do anything. Central government has not done anything. In fact, if they make this public health as a fundamental right and
You
a
think
national
that
law.
will help a lot. Okay, Paramita, I believe you're back. We couldn't hear you before. Tell us about, as someone reliving that, going through that horror, to see it repeat again just 5 years later, what does that mean to you?
Yes, it is again after 5 years, the same thing is getting repeated. The only thing I can say is that there are no lessons learned. There is a violation of the safety and the standard forms. It has been violated tremendously. The hospital management who have they are always trying to make it the medical as a business, big business. They are trying to cut down the costs by compromising the safety standards of the patients. So it is by knowingly everything they are doing it. It is like a criminal offense, what I can say it. And there are no lessons learned. There are lack of disaster management system. The patients who are coming to the hospital, they are the most vulnerable, and they can face deaths at any moment. So the responsibility lies on the top management, how the safety, security of the patients can be treated. It is not that medical cannot be done only as a business. The safety standards needs to be looked into it.
Take the example of Delhi.
Yeah.
I may tell you, a number of times fires has taken place. Cinema, area, hospitals, and every time there is a committee. I know in 1999 when I took up the case of Lal Kuwa fire where 57 persons were died. In record, High Court record, I got 20 reports by that time.
No,
every
so I want
time.
to ask, Ms. Patel, there's a probe being done right now by the state government. Can the union government suggest action or get involved in that probe report once the result comes out?
The state government has ordered a high-level probe, and I think we must wait for the outcomes. And as the Honorable HFM also said today in the press conference in Odisha, that strict action must be taken against the culprits, because that would be a lesson for violators in future. And whoever violates the building laws or whoever gives permission for such things, they will get threatened that these kind of repercussions may occur. So it is for the state government to take a strict action, because And we must understand,
Okay.
because again and again it's being said that the center is not bearing a responsibility. See, we must understand that our country has a federal structure. There is a clear-cut division of
Yes.
work
No, I
between the
understand
state
your point of
and the
view.
center.
I just
We
wanted
will
to just
only
interrupt
do
you
what
over
is
there.
within
And
our
Dr.
limits
Naresh
of
Trehan has
functioning.
also joined us. Yeah, Dr. Naresh Trehan has joined us. Dr. Trehan, you know, one of the things that has been pointed out in this hospital fire is that there was no proper drill at the hospital. That last fire safety audit was done 3 years ago. Can you tell us how is it possible for a hospital to operate without these basic things in mind? And apparently in Odisha, 1,700 of them are operating. Only 4 have the necessary clearances.
It becomes the responsibility of the authorities to really regulate, because a hospital is the most vulnerable place for fire for the patients, because they're all immobile, a lot of them in the intensive care unit. They're on respirators, there's oxygen running, and it's all life and death anyway. So not to have an effective methodology already adapted to your facility, where everybody is trained in a drill, where all the requisite fire safety measures like sprinklers, air evacuation, compartmentalization, and proper hydrants where you can get the water if you need it,
Yeah.
and fire extinguishers.
Okay, hold that thought. We're going to take a short break. When we come back, a few more questions on this. So we'll continue with Dr. Trehan, Anupriya Patel, and the others. Stay with us. Welcome back on Agenda. We are talking about the impact and the aftermath of the SUM fire in Odisha. Dr. Naresh Trehan is with us. One of the things that we were talking about with the health minister is how do we ensure this doesn't happen, because it falls between this, you know, it's a state subject.
Well, you know, we got a wake-up call 5 years ago in that Calcutta hospital. If in spite of that, which was a very expensive lesson, we do not implement the laws the way they are written, it's all written, it's not like it's rocket science, but they have not been implemented and the authorities may or may not have enforced them properly. How many times do we have to learn this lesson? It's, you know, it's human lives. If they are lost, they are lost. So I think that we should at least take this as a most serious event, much like we talk about a terrorist attack, and take action at every level so that when patients go into a hospital, at least the safety measures are there. Now, accidents can occur, but still, if there is lack of any facilities, it's only going to make it worse.
What was the question that you had about this? Yeah, go ahead.
What would you say is the biggest step we can see being implemented with regards to hospital safety in the next few years?
Well, first of all, like I said, there are 22 well-set standards for every institution. And that leads to the fact that wherever the vulnerable areas are, they are protected the most. Now, all buildings now have to have sprinkler systems. All of them have to have air evacuation so the smoke can be removed, because smoke kills more people than fire itself. So we need to have that. Third, we have to have compartmentalization so that you can actually contain the fire.
Can't the MCI get involved and bar these hospitals and who don't
No,
have these?
MCI is not the administrating body for that. It is the local fire authorities and the local government that enforces fire safety laws.
Okay.
Now, so the other thing is that yes, NABH, which is the National Accreditation Board for Healthcare Services, they inspect it.
Yeah.
And they can cancel the license and say, till you fix it, you cannot take.
Well,
take
hopefully,
patients.
yeah, you're totally out of time.
Lack of laws also, lack of enforcement machinery also. State don't have a enforcement machinery also.
Yeah.
That is the whole problem.
Well, we didn't see the wake-up call after AMRI.
Yes.
Hopefully, after SUM hospital tragedy, we will see people waking up, doing something about it, and that the fire services clearance just gets a little more teeth so that hospitals just don't operate if they don't have the right clearances. Thank you very much, Dr. Naresh Trehan, Mr. Sharma, also Paramita Gaur-Thakurta, Ashok Agarwal, and of course, Anupriya Patel. That's it on Agenda. Thanks for watching. Goodbye.